Infections are one of the main causes of maternal and neonatal mortality. Infections are caused by invisible germs, which in most cases are transferred from healthcare workers' hands, either from another patient or from contaminated equipment and surfaces. These infections can be prevented. Hand hygiene. Perform hand hygiene before and after every procedure, even when hands are visibly clean. Wash your hands with soap or alcohol-based hand rub. Use hand rub when hands are visibly clean, as hand rub kills more germs than hand washing. Germs can hide. Always have short fingernails and do not wear nail polish, artificial nails, rings, long sleeves, wristwatch, or bracelets. Procedure for hand washing. Wet hands with clean running water. Use liquid soap from a dispenser. If not possible, use plain and visible clean soap from a rack that drains. Germs will grow in wet, dirty soap. Apply soap. Vigorously rub all areas of hands and fingers together for at least 15 seconds, especially between fingers and under fingernails. Rinse hands with clean running water. Close the tap with your arm. Use paper towel to dry hands. If not possible, use a clean towel, but make sure the towel is clean. A shared towel that has been used multiple times by multiple people quickly becomes contaminated and can transfer germs to your hands. Therefore, wash the towel after each use. Procedure for hand rub. Apply a palmful of hand rub to cover the entire surface of hands and fingers. Rub the solution vigorously into hands, especially between fingers and under fingernails, for 20 seconds. See procedure on how to make alcohol-based hand rub. Perform hand hygiene before and after patient contact, after contact with patient surroundings, before a clean procedure, after body fluid exposure risk, and before and after wearing gloves. Personal protective equipment. At birth, wear plastic or rubber apron to prevent body fluids on your gown or body, wear gloves when you're in risk of touching body fluids, and change into clean closed footwear. Preferable, use sterile gloves. If they are not available, use clean examination gloves. Do not wear the same pair of gloves for multiple patients. It is important that you put on sterile gloves correctly so they do not get unsterile. Prepare a large, clean, dry area. Open the outer glove package and perform hand hygiene. Open the inner glove wrapper, exposing the cuffed gloves with the palms up. Pick up the first glove by the cuff, touch only the inside of the cuff. While holding the cuff in one hand, slip your other hand into the glove. Pick up the second glove by sliding the fingers of the gloved hand under the cuff of the second glove. Be careful not to contaminate the gloved hand with the ungloved hand as the second glove is being put on. Adjust the glove fingers and cuffs until the gloves fit comfortably. Be careful not to touch anything non-sterile before touching the operational site. When removing gloves, do not allow the outside surface of the used gloves to come in contact with your skin. Place all waste items in a leak-proof container with a lid. Cleaning and decontamination. Wear utility gloves and an apron to protect from any splashes. Disassemble all items. After use, all items should be cleaned immediately in a soap solution made of water and detergent. If not possible, Soak the items in the soap solution until cleaning is possible. Clean items with a brush in the solution. Do not use bar soap for cleaning items. Rinse items with clean running water. All items should be individually inspected and be visibly clean. After cleaning, soak all items in a 0.5% chlorine solution to decontaminate for 10 minutes. See procedure on how to mix a chlorine solution. Rinse items with clean running water and air dry before sterilization or high-level disinfection. Storage. The risk of contamination is high when sterile items are in a sterilized container that is repeatedly opened and closed each time an item is removed. If items get contaminated, it must be re-sterilized. Therefore, items should be divided into each procedure and sterilized, either wrapped in cotton fabric or in a small covered dry sterile container. Keep the sterilized items in a closed cabinet. Arrange cleaning and storage so activities and objects flow in an organized way from contaminated items, cleaning, decontamination, sterilization, or high-level disinfection to storage. Separate the dirty and clean areas. Housekeeping. Clean high-risk area with disinfection solutions that is made of detergent and 0.5% chlorine solution. Clean washable bed, table, floor, toilet, and delivery bed. Clean even if there was no birth at the delivery bed. Spread of germs can be prevented with simple hygiene procedures, but it requires facilities, discipline, and consistency.